bring your chin up just a little. Perfect. You can bring it down.
So make sure that line is parallel.
That's from the chin to the ear?
Chin to the ear, yep.
Okay.
And then since our stuff is already lined up, we're just gonna flip the table. The central ray is going to enter the mid-occipital bone. The table doesn't go down anymore.
Do you have that much space that way, or?
We may have to scoot her down.
Down?
Mm-hmm. Come down on the mattress. Keep going, keep going. That's good right there. A little bit more. Okay. Relax your shoulders. So it's going to enter the occipital right there. Basically, you want it exiting that same spot as the fuchs. So it's going to enter right there and exit the bottom of her chin. Collimation is going to be 5 by 5.
For the fuchs, it was 5 by 5 as well.
Mm-hmm. Oh, going the wrong way. So it's going to be very tiny, the opposite of fuchs. Make sense? So that's your Judd method. You can turn on your back, Emily.
But this isn't one that we really have to do.
No, not that.
You did test out?
Is it that how it always is?
Why is my collimation not working?
I have to check this stuff. Miss Bonilla,
Yes.
how many days of practice are we gonna get on this before test out?
1.
Wait, test
Oh,
out
'cause
next
last
week?
time it was 2.
Not next,
No,
the week
next
after.
week is extra.
Oh, yeah, okay.
So now we're gonna do our APT spine. SID is still going to be 40.
You do that laying down?
Okay. You can do it laying down or standing up, but it's most often done laying down. SID should be a 40, so don't pay attention to that. So our top of the light is going to be about an inch above her shoulders. You can close your eyes, Emily. Okay, so you want top of the light 1 inch above the shoulders. Lengthwise is going to be 17. And then from side to side, you just need it maybe about 8. Because you're only focused on the T-spine. So that's our APT spine. Okay, let me just adjust the buggy. So
And where do you
lined up.
center for this?
T7, see how it's by her axilla?
Okay.
But as long as you have 1 inch of light above the shoulders, you should be good. That's our T-spine. Make sure their legs are nice and straight.
Do they have to be turned in or anything?
No, no, no.
Okay.
Make sure they're straight. Lengthwise 17, and then just about 8 inches side to side. That's our APT spine. Respiration for this one is suspend after full expiration. So take a deep breath in, blow it all the way out, hold it out, expose, and then you can breathe. All right, let's do our lateral T-spine. Go ahead and turn on to your left side. Good. You can put both palms under your head like you're sleeping. Make sure you keep their knees bent. And you see how she's kind of diagonal right now? So have her scoot her hips forward, so she's straight. A little bit more. And then make sure that back is also straight, right? You want to feel the back to make sure it's nice and straight. So if you come down to the head of the table, see how her shoulders and her hips are in one line? That's what you want. So if you come over here, you can see what I'm talking about.
Go ahead, do. Oh, no, go take a look, go take a look.
See how it's all in one line? That's what you want to see. So for the lateral T-spine, the centering is not going to be perfectly at her MCP. Why?
Because the spine's in the back.
The spine's up towards the back. So you want to see a little bit of light behind that shadow right here. And then most of the time for T-spines, you will take 2 pictures, upper and lower, unless they're very tiny. So for the first one, you just want a little bit of light above the shoulder. Okay, and then for the lower part, you would just keep your hand in the light field and overlap. Like that. Make sense?
And, I forgot, what are we, oh, yeah, so we're still at T7.
Yes.
Okay.
Mhm. So that's your lateral T-spine. So if you, after you take the first picture and you think there's still some vertebrae left, you can just do the overlap. All right. So that's it for our T-spine. Now we have something called the swimmer's lateral. So that is specifically done to view our C7, T1 space. So swimmers, why is it called swimmers? Because it's like they're swimming. Bring this right arm down on your side, and this left arm is gonna go straight up. Yep, just like that. Patient's gonna be in the lateral. Everything stays the same. SID should be at 40. We're going to enter the C7 area. And then collimation is going to be 10 by 12. So it's kind of like skimming the top of her shoulder. Okay. And let me see if there's any particular reading instructions for this.
Could they all just be fully exhale and then hold?
For this one, it just says suspend.
Okay.
So yeah, basically
Okay.
fully exhale and hold. It says collimation is 10 by 12, but we don't need that much. So that is what your x-ray should look like. You can do this either laying down like this or have the patient standing up. You can relax, Emily.
But it'll still be the same, like centering, right, if they're standing?
Yes, same centering, because you're still interested in that C7T1 interspace. Have you guys seen this done in clinic?
Yeah, but I've seen it standing up. I've never
Standing
seen
up?
it-
Oh, okay.
I think I've seen it laying down like once or twice.
Okay. Yeah, if your patient's able to stand, do it standing.
Would they also be able to do it in a wheelchair?
If you can somehow get all of the artifacts out of the way, yeah, you could. Like have, put a wedge behind their back to have them lean forward and have their left arm up. I don't see
They
why
could
not.
Probably hold a detector or something like that.
Well, if they put the detector there, they might clip T1.
T1.
Yeah. So last one, this is our trauma C-spine. So for patients that come in through the shock room and we're not able to do a regular C-spine, we would do a trauma C-spine. So lay on your back. And Jay, if you could set that up for me, please.
For
Oh, C-spine, yeah.
Yeah, so put your 10 by 12.
Thank you.
Crosswise.
Is it crosswise?
Yeah, just like that, because we want to see the whole vertebrae. So to rotate the tube this way, I'm hitting my purple button right here. And then there's a little thing here, CJ, this
Yeah.
thing. Hold this down to rotate it
Okay.
all the way.
Okay, purple and that to
Purple
rotate
and
it.
that, yes. And then the black will let you angle it up. So SID for this is going to be 72. Make sure your free cassette light is lit up, this one. And then how are we gonna measure our SID? Mm-hmm. Hold it till it beeps.
Sorry.
Okay, stay right there.
Oh, you said stay there? Or?
Yeah, stay right there. Let it beep. It says 75, so I need to come back. Perfect. Now we're at 72. So you want to measure your SID when the tube is slightly high up on the IR. You don't want to measure it when the tube is down because it'll be diagonal to tape measure. Does that make sense? Okay, so we're at 72. Collimation should be 10 by 12. And where are we going to enter? Where do you think we should center? C4. And then it should be centered in the patient's midline. Right there. So we're midline and we're entering at the level of C4, okay? Now, we have just enough room to put our marker and make sure this is also lined up to our central ray. You can put your left marker here and that's it.
This is for when they have a.
See color. Or they're not able to move their neck.
And you said midline or just underneath midline? Because the spine is.
Middle of their neck, let's say
Okay.
that. Relax the shoulders down. So middle of their neck, entering at the level of C4. You can open it up slightly a little bit more if you want to, but we don't want light on the wall. We're at 72. You want the cassette under the mattress, not by her shoulder, because you don't want to clip what's in the back.
The spine.
Spinous processes. So that's our trauma C-spine. It's pretty simple, right?
Yeah.
And that's it. You guys want to practice any of the ones we
And
just went over?
that's the end for lab, for study? Okay, cool.
Yeah.